Golfers worship it and curse it, from the deep shadows of morning to the glare of high noon. Light is everything out here. Transitions lenses enhance contrast by helping reduce glare so you can see clearly in all light conditions while helping protect your eyes from the harmful UV rays of the sun. Go on, live your vision, out here and everywhere. Ask your eye care professional today about Transitions lenses.
Just look at the difference a new Crizal lens with Scotchgard protector can make on your sight. Neither rain, nor snow, nor dust, nor dirt, nor smudge, nor scratches, nor glare of night can keep your lenses from giving you the clearest vision possible. New Crizal lenses with Scotchgard protector. Live life in the clear.
Welcome to the Hour Gallery. Today I'm going to tell you a little bit about some of the custom lenses that we make that go with all these great looking frames that you'll see behind me here. Just like a pair of shoes, you wouldn't wear the same pair of shoes for everything that you do. So there's hundreds of lenses on the market, and each of those lenses solve different issues for you. We have the light active ones that when you go out in the sun they change. We have the Verilux, the progressive lenses that cover all the different reading zones when you look far away to up close, and an array of other specialty lenses that fall in between there. And as the master optician and lab manager here for the office, I've spent years learning about those lenses, and when it comes time for you to think about solving your vision care problems, you don't really have to know all of that product information. You come to us and we'll help you work through all those many choices to get you just the right pair. We have computer pairs for when you're at the office and you're having trouble with the computer, your tablets, your phones, all of those things in your life that may give you some concern when you're sports and active, running. Do I have a bifocal in my custom sunglasses? You know, we help you work through all those issues, and we're going to find just the right lens to fit just the right frame. And we start by looking at the prescription. Of course, everyone loves the frames, they're beautiful, but we want to make sure that that combination of the lens and the frame together gives you the perfect fit and the perfect vision. We want you to see great and look great as well.
Crizal lenses reduce the eye strain and discomfort associated with computer screen glare. They minimize the effects of harsh lighting or prolonged TV viewing, like dry, burning eyes. Less glare means improved concentration and visual comfort at work, at home, or anywhere.
Crizal has really reduced the eye strain I usually have from working at the computer. Great product.
Got your glasses ready for you. We made that custom pair for the computer that's going to work really great for you and help you throughout the day doing your computer, also looking at your phone and things like that, so it's going to help a whole lot in those areas. Let's give them a try on and see how they work for you.
Well, that's what the doctor recommended in the exam room when I was here last time. So as far as seeing you at that distance, I can see you, so I want to make sure they're working on my computer because that's a little further out than my bifocal range. I guess the last thing I want to do is pick up my phone and see if I can see with that. And I'm just going to compare these, if you don't mind.
Absolutely.
I just put my regular glasses on because my neck was starting to hurt back here. So I was having to look through my bifocal, and that was just a small area to see from, and it wasn't quite as good. I was hoping as what I was going to get these computer lenses, and it's like, wow, these are fantastic.
Absolutely. It's going to give you those wider fields of view in both the computer distance for like your phone, tablets, things like that. And then if you get up at the office and you walk around, you tilt down just a little bit, let you see across the room to kind of, if you need to recognize somebody, but just in your workspace zone, it's going to be great. You're going to see clear and everything's going to be sharp for you.
Great. And then when I'm trying to see really fine print, you said that I could look at the
Absolutely.
bottom.
Yeah, let's try. This is some of our smallest print here that you normally read.
I can read every one of those. VIST 304.
Yeah, and then you'll notice you can cut over to the computer, and that's going to be sharp as well. So,
Wow,
so
this
you're-
is great.
You're good in all those zones. Well, I hope you really enjoy those. I know you're going to. We've got lots of these, and it solves a lot of problems, especially people that complain about the neck problems.
That was really starting to hurt me. That's where that discussion came up in the exam room, so.
Absolutely.
Thank
Well,
you so much.
I'll do the final adjustments here in just a minute or two, and then we'll go over all the warranties and things, and you'll be all set to go.
Man, it's great. Thanks.
Thank you. Welcome to the Eyewear Gallery. Today I'm going to talk to you a little bit about specialty sports sun lenses. And as the lab manager and master optician here at the Eyewear Gallery, I've spent years studying these types of lenses, so I'll be able to help you pick out just the right lens and just the right frame no matter what your sport is. We cover a range when we do sports from far away to all the up close vision that you need, and this is going to help you really get your best vision and perform your best in whatever sport you're doing. So we've got some high technology that we use to help really pinpoint the way the frame fits and to help us pick out just that right lens as well. So no matter what your needs are out in the sun, we've got just the frame and the lens combination for you.
Experiencing extreme glare. Xperio polarized lenses recommended. With Xperio, experience clarity like never before.
Wow, that is clear. But maybe I'll go for a drive.
Warning, extreme glare delays reaction times. Xperio polarized lenses recommended. With Xperio, experience safety like never before.
Or maybe I'll go for a hike.
Natural color rendering off. Xperio polarized lenses recommended. With Xperio, experience beauty like never before. You require polarized lenses that not only deliver superior UV protection, but also eliminate bothersome glare, making your world more safe and more beautiful. Xperio polarized lenses are recommended.
Now, do you know where you got those sunglasses?
At a convenience store.
At a convenience store. Let's think about that for a moment. A convenience store sunglasses. I'm sure they're top quality.
Oh yeah.
Yeah. Now, do you think, okay, they're shaded, they're dark lens, so they must be protecting my eyes?
I hope so.
Yeah. Well, I don't know if hope's gonna cut it, Chad. Here's the deal. You have to have a UV protected lens. Otherwise, yeah, you might as well just be, you might take the lenses out and just wear the frames. Now, see, here's the thing. A lot of people don't understand that they don't have to be colored. Even a clear lens, as long as it has UV protection, is just as good. Did you have any idea?
I had a sticker on it when I bought it.
Well,
That went to the trash.
It finally dawned on me one day that I needed an eye exam. While driving past my neighbor's house, I waved to what I thought was Jeff bent over. My sons pointed out that I was waving at a rock. Since then, I've been called Mrs. Magoo more times than I can remember.
Ah, there he is!
But it was also kind of scary. I went for my first eye exam in many years and learned not only did I need glasses, but I also needed bifocals.
More than 2 million boomers have glaucoma, and another 2 million have the disease but don't know it. More than 30 million Americans aged 40 and older suffer from eye disease. Many new cases are curable or preventable by detection through an annual comprehensive wellness exam and proper treatment.
In order to keep your eyes and vision healthy, schedule an annual exam with your eye doctor. Vision screenings, like the ones administered by the school nurse, use the traditional eye chart to test basic sight. These tests are vital, but not comprehensive enough.
1 in every 4 children have vision problems that can interfere with learning and behavior. Often, the only eye test most young adults have is a brief eye chart exam at school. An exam that doesn't always identify all vision problems. Each year, thousands of young adults suffer from undetected vision problems that can make school and life difficult. Many are misdiagnosed as having a learning disability, or ADD. Young adults with poor vision may struggle to read, have short attentions, perform poorly in sports, and develop low self-esteem. The solution is an annual eye exam at your eye doctor. Get corrected. See well, learn well.
It's time to play America's favorite game show, Know Your Eyes. I've gathered up our contestants, and here we go. Sitting too close to the television is bad for your vision.
True. True. True.
True. Definitely true. Our survey says it's false. All right, here we go. Question number 2. Eating carrots is good for your vision.
True.
Be good.
False.
Yeah.
True.
True. And that is? Ding, 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 ding. What about reading in the dark? Is that bad for your eyes?
True.
You said that with confidence. You said true. Bam, print it. I know what I'm talking about. Why should people go see their optometrist?
For you to see okay.
That's right. Exactly right. You were charming. Thank you very much.
The new Definity lens is the ideal progressive lens choice for presbyopes with active lifestyles. Precise alignment on front and back and an improved design symmetry delivers even wider fields of vision and improved distance. Definity Dual Add 2.0 still features its unique ground view advantage, but with even greater distance. The Definity lens you know and love just got better. Definity's Dual Add Technology 2.0 allows for a smoother transition in all zones of vision, with even wider intermediate. Definity Dual Add 2.0 delivers the least amount of peripheral distortion while optimizing near vision. Definity Dual Add 2.0 still delivers smoother transitions between near, intermediate, and far distances with greater ease and comfort. So whether you golf, play tennis, or hike, play an instrument, work on the computer, or simply enjoy an active life,
A major complaint about glasses is the glare and halo effect experienced with nighttime driving. Crizal enables you to react faster and feel safer behind the wheel. It cuts down on the reflections and glare from headlights and other light sources. A recent study measured the effect of anti-reflective lenses on visual recovery times in response to bright light. This is similar to what your eye encounters during nighttime driving. With Crizal lenses, patient reaction times were an average of 38% faster.
Crizal lenses really made a difference in my night driving. I almost enjoy driving at night again.
More than 1 million Americans are blind. The 4 common causes are cataracts, glaucoma, age-related macular degeneration, and diabetes. This is normal vision. This is with cataracts, this is with glaucoma, this is with macular degeneration, and this is with diabetic retinopathy. And if left untreated, they can all end up looking like this. We know diabetes, the leading cause of new cases of blindness and amputations and kidney failure, can be prevented, managed, treated, even cured with a plant-based diet. But what about the other 3 common causes of blindness? Researchers recently looked at the connection between overall diet quality and age-related macular degeneration, but diet quality based on whose criteria? They based it on the Alternative Healthy Eating Index developed by Harvard. You basically get scored 1 through 10 based on each food group. If you consume 5 servings of vegetables a day, for example, your vegetable score is a 10. 4 servings of fruits a day gets you a perfect fruit score. If you eat vegetarian, you get a perfect 10 in the meat department. Then more whole foods, less trans fats, etc. And based on these criteria, they concluded that advanced age-related macular degeneration was significantly related to overall diet quality.
With normal, healthy vision, everything you see is clear and in focus. Many people refer to this as 20/20 vision. You can see all objects clearly, whether they are close up or in the distance. This is a normal, healthy eye. In order to see, there must be light. Light reflects off an object and enters the eye. The light passes through the clear covering on the eye, called the cornea, that helps focus light through the pupil. Next, the light passes through the eye's crystalline lens, which constricts to help light rays focus on one point on the retina, resulting in clear vision.
Dry eye has many causes. Some causes are from various external influences, such as one's environment. Other causes are related to changes in the body's nervous, hormonal, and immune systems that can occur over time. When a person has chronic dry eye, inflammatory changes in the tear-producing glands and in the eye's surface can interfere with the production of normal tears. When this occurs, the eye produces fewer tears that are less effective. This results in a tear film that evaporates more quickly than normal, which provides less moisture and protection for the eye's surface. With the tear film's protection diminished, the eyes may experience painful symptoms of dry eye, and damage to the eye surface may occur. A person's age, health, environment, and lifestyle can all affect one's risk of developing dry eye. Dry eye is more common among people over age 40, and especially among women around the age of menopause. Patients with systemic inflammatory conditions, such as rheumatoid arthritis, lupus, rosacea, or Sjogren's syndrome are also at risk. Certain medications can worsen dry eye and its symptoms. These can include certain medications for the treatment of depression, high blood pressure, allergies, hormone replacement therapies, and diuretics. While they are not the root cause of the condition, environmental factors including air pollution, dry weather, and persistent wind can worsen the symptoms of dry eye. Heating and air conditioning can create similar environmental conditions indoors. Everyday activities such as driving, reading, focusing on a computer screen, or watching television can also worsen dry eye symptoms.
If your eyes are itching, tearing, burning, or red, you may have eye allergies, or what doctors call allergic conjunctivitis. Allergies develop when the body's immune system becomes sensitized to something such as pollen, dust, pet dander, or mold. These are called allergens, and there are many potential allergens in our environment that can come into contact with our eyes. With allergic conjunctivitis, allergens cause the eyes and surrounding tissues to become inflamed and uncomfortable. These symptoms may occur alone or in combination with general allergic symptoms, such as coughing, sneezing, or a stuffy nose. There are two main types of eye allergies: seasonal and chronic. Seasonal eye allergies are the most common form and occur in the spring or fall, when the amount of pollen in the air is very high. Chronic eye allergies are less common, but potentially more severe than seasonal allergies. This form is non-seasonal and occurs continuously throughout the year. Chronic eye allergies may be triggered by dust, mold, pets, or other allergens that are present year-round.
So I've been wearing contacts for nearly 10 years now, and I've always wondered, is touching my eye every day doing something bad to my eyes? Apparently, putting contacts in your eye is not a neutral act, according to microbiologist Maria Gloria Dominguez-Bello. In fact, contacts might change more than just your vision. Dominguez-Bello and other researchers from NYU's Langone Medical Center found significant differences in the ecosystems of the eyes of people who wear contact lenses and those who don't. They had 3 times the usual proportion of certain bacteria like methylobacteria, lactobacillus, and Pseudomonas bacteria in their eyes. Basically, the bacteria on the surface of their eyes looked more like the types of bacteria found on their skin when compared to those who don't wear contacts at all. But the researchers still wonder if this altered bacterial composition is because contact wearers keep touching their eyes with their dirty little fingers, or if it's the lens itself that is changing the immune system of the eye, so more research is needed there. However, the researchers think this could be part of the reason contact wearers get more frequent eye infections. Since the 1970s, when soft contact lenses came on the scene, corneal ulcers have been on the rise. Corneal ulcers leave a nasty open sore on the cornea. They're caused by bacterial, fungal, or viral infections, mostly Pseudomonas. Since that type of bacteria is found on the skin, maybe eyelid and hand hygiene is to blame. Specifically, another study published in Optometry and Vision Science identified 3 specific behaviors that might lead to nasty infections. And they're pretty straightforward, like not washing hands with soap and water before handling contacts, not letting the case air dry, and surprisingly, and I'm a little skeptical on this point to be honest, using a contact case and a solution from different manufacturers. I mean, some bottles of solution come with cases, but I just assumed they were being nice, and all that please use our solution for best results or whatever was just marketing BS, but maybe not. And if you're too lazy to do any of the above, you could try contacts coated with antimicrobial stuff.
You're ready to get contact lenses. Feeling anxious? Don't be.
Getting contacts is simple. Start by making an appointment with an eye doctor. A first fitting takes a little longer than an exam for eyeglasses, so let the eye doctor know that you're coming in for contact lenses. At the office, the eye doctor will review your history and check your vision. Let the doctor know if you play sports, have seasonal allergies, spend a lot of time in front of a computer, or anything else you think might affect you wearing contacts. This will help determine the right contact lens for you. Trouble-free lens wear starts with healthy eyes, so the doctor will take a close look at everything. The diameter and curvature of your eye will be measured so that the lens will fit just right. Typically, you'll be given trial lenses to start. After a few minutes of getting a feel for them, the fit of the lens will be checked along with your vision. The eye doctor will show you how to put on and take off your contacts, and how to take care of them. If you're unclear about anything or wondering how you'll know if there's a problem, just ask. After about a week of getting the hang of your contacts, you'll return to the office for a follow-up visit. In the unlikely event that something isn't right, tell your doctor. For the best experience with your contacts, always follow the wearing schedule the doctor gives you. Clean and care for your lenses, and get a yearly checkup.
Doctor, what are cataracts?
A cataract is a clouding of the lens of the eye. The lens is like a glass window that we look through to see. It is made of water, protein, and other chemicals. With aging, these proteins become cloudy and interfere with the passage of light. As cataracts progress, it is hard to see clearly. Cataracts are the leading cause of blindness worldwide.
Doctor, what causes cataracts?
The cause of most cataracts is unknown. Some cataracts can be caused by long-term use of steroids, infections of the eye, and illnesses such as diabetes. Most often, cataracts develop with aging.
Doctor, what are the symptoms of cataracts?
The major symptom is blurred vision, also poor sight even with eyeglasses or contact lenses, ghost-like images, glare, and a halo around a light may be noticed.
Doctor, how are cataracts diagnosed?
Your doctor will suspect a cataract based on your history and eye exam. Wear sunglasses that block 100% of both forms of ultraviolet light, UVA, and UVB, especially in sunny climates. Do keep your blood sugar level well controlled if you have diabetes. Cataracts grow faster when the blood sugar level is high. Don't postpone surgery unnecessarily. Eye drops, medicines, diet, or exercises are of no use in treating cataracts.
Open-angle glaucoma is the most common form of adult glaucoma and can lead to loss of vision or blindness. This type of glaucoma can only be detected by your eye care practitioner through a routine eye examination. Open-angle glaucoma occurs when the eye's drainage system becomes clogged over time. A part of this system, called the trabecular meshwork, is a tiny spongy tissue that allows fluid to leave the eye. This structure is situated in the eye's angle where the iris and cornea meet. When this drain becomes clogged, aqueous fluid cannot leave the eye as fast as it is produced, causing the fluid to back up. This backed up fluid increases pressure in the eye and can cause damage to eyesight. If open-angle glaucoma is not diagnosed and treated, it can cause a gradual loss of vision. This type of glaucoma develops slowly and usually without symptoms. For more information, ask your doctor about open-angle glaucoma